like you have a specific bed in a specific room and you have that patient in the bed, but that patient has to get moved to another room or to an ICU. As you take that patient and roll it in the bed, you can move that piece of equipment from room 220 down to ICU room 8, and you can still track that bed on the QR tag, and you can find out the history of when that piece of equipment was last serviced. Let's say you have 500 beds. If you have a 250 room hospital and they have 2 beds apiece, 500 beds, they all look alike. Once you put them into the system and you create that file for that specific piece of equipment, anybody from the maintenance team to the president of the hospital or the CEO from the hospital can go in and look up when that bed was last worked on or serviced. And at some point in time, if that bed is 9, 10, 12 years old, you can see how old it is, how many times it's been worked on, and then you may have to go ahead and get rid of that bed and buy a new bed.